Welcome back to the Arizona Daily Mix. We are on a countdown, you could say, to the next heart procedure with Dr. Rizik and his team. It's going to be June 23rd. And doctor, over the last couple of weeks, we've been getting the lowdown about different measures here for, of course, heart disease preventing, what we're going to be seeing. And last time you talked about the difference between a bypass surgery and a stent. So now let's talk about the balloon and a stent and how this all came about.
Well, I think the history is fantastic. If you go back to 1977, a Swiss radiologist named Dr. Rizik, who's sort of a pioneer, he's the godfather of the modern era of opening blocked arteries. He took a simple balloon, he was working on this technology, and he took a simple balloon and opened up a blocked artery in a patient. And he was able to open that artery and he was able to keep it open. And it was a simple, tiny, 20 millimeter balloon. That's how tiny the arteries are. And with that, we were off to the races. That was the beginning of modern therapies, if you will, for coronary disease, non-bypass modern therapies.
Yeah.
We had bypass, but this was the first of the non-surgical catheter-based procedures. And through the 70s and 80s and even into the 90s, we were performing procedures using balloon angioplasty, using tiny balloons to open the arteries. Now, the only problem was that you would open the artery, and because these arteries have elastic tissue in them, they would close about 40 or 50% of the time. And oftentimes they had to come back either for a repeat balloon procedure, or many times we would send them to bypass surgery thinking that balloons didn't work.
Yeah. So let's remind people, because the artery is so small, and the reason why is that stuff collects in that artery, right? It's a calcium kind of, is that?
Calcium is one of the components, and you're going to see how we treat calcium in the cath lab. A lot of it is fat and cholesterol, but it's elastic tissue, fibrous tissue. And you can dilate those up with the balloon, but oftentimes that elastic tissue over 3, 4, 5 months allows the artery to reclose.
Right.
If all you do is use a balloon.
Yeah, and the balloon's kind of like smooth because it's a little smooth balloon. So
That's
now
correct.
with the stent is kind of like almost a cleaner in a way, correct?
Yeah, you make a great point about bringing stents into the discussion of balloons, because stents are like a spring on an ink pen. Imagine if you had a spring on an ink pen and you could place that in the coronary arteries. Well, that elastic tissue could not close the artery because you have that spring or that stent to maintain the integrity of the artery. And that's how stents came along. Two brilliant doctors, Drs. Paul Maz and Dr. Schatz, and I used to work with Dr. Schatz, he was here in Arizona, in fact, developed the stent. And the stent, as I said, is like a spring on an ink pen. You deploy that in the artery, and unlike a balloon, it can never close because that metal stent stays in the artery.
You just made me feel very comfortable coming to see you to have a stent put if I ever need to, and hopefully I don't, because you said something that's so important, that you have been there at the beginning of this. You trained under the people who discovered this, and knowing how this is so life-saving. So you know all the ins and outs of how this stent, where to put it, what's going to go on with this. And that's why you talk about prevention, because you've noticed everything that goes on in the heart, especially with the stent going in.
What's interesting about the stents is putting a metal implant and leaving it in a coronary artery in 1994, it was like heresy. People thought this is the worst thing you can do. And it actually was the beginning of so many subsequent life-saving procedures that was based on stent technology. It's remarkable. But when we first talked about bringing stents, including to the Valley here, it was like heresy.
Yeah. Wow, amazing. I want to make sure we have our audience understand something out there, is that, you perform this on both men and women, and this is something that is done for both men and women, but to really, prevent heart disease, you guys look at women and men differently and see what their symptoms are, because it's a total different situation.
Well, you once again have made great points. Prevention is the key, and preventing it in men and women, you can never start too early. And when you look at the symptoms, as we've said several times over the past several weeks, can be very different. So we can treat them the same once they end up in the operating room or in the catheterization laboratory, but prevention and testing and symptoms can be very different between men and women.
Yeah, and I know there's people sitting at home right now watching us and probably have questions and wondering things, and I do want to ask you two things. The first one is about preventing, of course, coming to see you to put a stent in. What's one thing you recommend?
To prevent?
Yeah.
Eat right, don't smoke, exercise regularly. I gave you 3. Okay, you asked for 1, but we're generous today. We want to give you 3.
So.
Eat right, never pick up a cigarette, and exercise regularly.
Okay, and then my next question is, what are some things you recommend after having heart surgery like this? I mean, what's going to definitely keep people not coming back to see you?
Yeah, so often, well, stop smoking. If you're a smoker, stop smoking. And really lowering your cholesterol. It's only recently that we've begun to determine and really understand that you can lower your cholesterol and help to prevent new disease from forming in those arteries. And probably the most important thing for diabetics is to get that sugar under control. There's a test that diabetics use called the hemoglobin A1C, or the glycohemoglobin. Get that number and your sugar as low as possible, and to prevent accumulating frequent flyer miles in our operating room.
There it is. Dr. Rizik and I will be in the operating room June 23rd, and it's going to be definitely one I'm looking forward to watching again and seeing.
People are saying, wait a minute, Brad Perry is coming back? Yeah. He's coming back?
So, Dr. Rizik, thank you very much. So, again, catch the procedure June 23rd right here on AZTV 7. Information's right there on the screen. And don't forget, you can go into our aztv.com/procedure to see the last procedure that we performed.